Il primo servizio di biopsia liquida avviato grazie al trasferimento tecnologico presso il Policlinico Gemelli di Roma discende da uno storico accordo con la Guardant Health, una società americana che porterà l'innovazione dei laboratori USA nella diagnostica oncologica di precisione italiana per rilevare alcune alterazioni geniche dei tumori del polmone e del seno, almeno per cominciare. Ne parliamo con il Dr Benjamin Gannon. Intanto, come si è arrivati a questo accordo tra Guardant Health e Fondazione Policlinico Gemelli?
Thank you very much for your question. Guardant has been present in establishing clinical collaborations in Europe for quite a few years now, since 2016, and more recently, in the last few years, the pace and the amount of work that we have been doing in Italy has expanded very substantially. In late-stage diagnostic testing for cancer patients, and also in early stages of minimal residual disease. Also, in terms of what we have seen in Italy in recent years around developments linked to the reimbursement of diagnostic technologies, and perhaps most importantly, the quality of the research and the clinical practice from institutions in Italy, and particularly here in Rome with Policlinico Gemelli. We decided at the beginning of last year to expand our activities in Europe and begun our discussions with Policlinico Gemelli to establish a partnership to establish a liquid biopsy testing facility in this country.
Cosa comporta per la vostra azienda questa partnership industriale di trasferimento tecnologico con l'Italia, con un policlinico italiano?
This is a very profound partnership and a huge opportunity for establishing this type of technology to benefit many thousands of patients in a very important European country. It's an important opportunity because of the level of scientific excellence, clinical excellence, and the national healthcare system in Italy is regarded very highly also internationally. And in fact, I mentioned previously several of the studies that we are invested in and partnering in Europe are with global key opinion leaders. In terms of the partnership with Policlinico Gemelli, I mean, we're very honored to be working with such a renowned institution with the scale and the capacity and the capability to be able to implement a high technology liquid biopsy assay which is very demanding and requires a high capability to be able to implement such a technology with high sensitivity and specificity.
Questa è la prima partnership di questo tipo in Italia e la terza in Europa. C'è qualcosa che rende difficile questi accordi?
The partnerships are profound in the sense that we need to work with a partner that is able to develop a technology and a liquid biopsy assay with high sensitivity, high specificity, and a fast turnaround time. That requires a very practiced and deep capability in oncology diagnostics, and it also requires a certain volume of patients in clinical research and also in clinical care to support the development of these partnerships. It's not a technology currently that is going to be deployed in many institutions across Europe, and it is very important that we work with the right partner which is able to deliver the highest clinical and research expertise in the country.